Welcome to this episode of Your Wellness MD podcast. Family physician and wellness expert, Dr. Daniela Steyn, has meaningful conversations that will take your health to the next level. She explores the connection between a healthy body, mind, and soul, and shares tips that will enable you to thrive. Dr. Steyn has helped thousands of people have a better quality of life by improving their health with science-based knowledge, education, better nutrition, mindfulness, and lifestyle choices. Join us today, empowering you to live your best life with optimal health.
Good day from me, Dr. Daniela Steyn, and welcome to this episode of Your Wellness MD podcast. I am a medical doctor and wellness expert. I am so excited to have Dr. Lara Hochman as my guest today. Welcome, Lara.
Thank you so much for having me.
So I've gone through burnout very early on in my career, and thankfully I've been able to recover from burnout. I've met wonderful female physician mentors. I've made it my mission since to help other physicians struggling with burnout, identifying those red flag signs indicating that their bodies are not coping with workplace burnout anymore. And I have resources specifically for any of our listeners who are interested regarding burnout. It's on my YouTube channel. Please subscribe. And I also have resources on how to identify burnout and how you can take control of your own health to recover from burnout. And all of these are on my website. You can find it at www.wellnessmdhealth.com. Today, as my guest, I've got Dr. Lara Hochman. She is a family physician. She's also from South Africa, as you'll hear the accent. She's an advocate for fellow doctors' well-being amidst this really rising burnout and dissatisfaction that we're having, even in our Canadian Ontario Medical Journal that I got yesterday. Front page is burnout. What are we doing about physician burnout? What are organizations doing? What are systems doing? How are we coping? And Laura, in her own experience, led her to discover the ways that physicians really lose autonomy. And she helps physicians to reclaim their focus on helping their patients. She has founded a business, Happy Day Health, which is a boutique physician matchmaking agency, which match doctors with very well-run, physician-owned private practices where they can avoid burnout and they can enjoy practicing medicine again. Laura, welcome.
Thank you. Thanks for having me.
So, Laura, tell our listeners a little bit about yourself.
Well, yeah. So, as you said, I'm a family doctor. I have two little girls. I have been through burnout a couple of times. So, I was very burned out once before, and really the second time of burnout, I would call it more of a moral injury, which is a new term that's come out, and I really do feel a difference between the two.
Yes, tell us a bit, because it's a new term to me.
Yeah, moral injury. So moral injury is kind of a new term that at least I've learned, and I think it's new coming out, but it's more along the lines of not being given the opportunity to practice the way you want to practice, or being told to do things that don't align with what you want to do. And, that to me really is what leads to burnout. That's what leads us to have that feeling
for sure.
of, just blah.
Oh, for sure. And you feel that if that's when it's in a situation where you have to practice in a certain way, that's infringing on your values, essentially your values as a physician and your values as a human being for caring.
Exactly. When we don't have enough time with patients, as one of many examples, if you have a patient that's in the room crying and you know that it's going to make you run late, you don't want to kick them out. And so then you run late, and, it just really is very against what we stand for as physicians.
So tell our listeners a little bit more. So I practice medicine in Canada, and our system looks a little bit different than yours look. You practice in Austin, Texas. Give us a little bit background. Where did you study and where did you work?
So I went to college at UT Austin.
Okay.
And medical school in Galveston, which is by the beach. It was amazing.
Oh, lovely.
Dolphins and
lovely.
it was wonderful.
No burnout there.
No. I was still an idealistic little medical student. But
Oh,
it was a wonderful place to study. It was a small island where we all knew each other. We all had our groups of friends, but we all got along. It was wonderful.
yeah.
And then residency we did in Colorado, Denver, Colorado. And then, so after I graduated, I did some locum tenens for a year while my husband finished up his residency. And then we moved back to Texas to be closer to family.
Yes. And
So,
then what does your typical working situation look like, your option, if you're a family physician in Texas? Because how it works here, it's very easy for physicians to just start their own practice. But I understand that it's not as easy or as smooth for physicians in Texas. So what's your options as a family physician? Where can you go work?
the options are endless, really. You can start your own practice. Most people feel overwhelmed by everything
Mm,
that needs to be done. We're not taught business, we're not taught
no,
anything to do with us starting a practice.
oh,
So,
for sure.
after, you know, having the water hose of information come at you for years and then all of a sudden have to figure it out it's overwhelming, but it's very, very
Mm,
doable. So that is an option. There's also many private practices that are doing very well. So if you don't want to start a private practice, but you want to be in private practice, that's certainly an option, very open and doable. And then what most family doctors do is they go work for a hospital system
okay.
that employs them to work in an outpatient clinic
At
as
the
a family.
hospital.
No, not necessarily. It's just run by the hospital.
Oh, okay.
Sometimes they're at the hospital, but sometimes they're anywhere.
Okay, okay, neat. But then the hospital takes care of the whole administrative aspect, hiring
Exactly.
staff.
Yeah, exactly.
Okay,
And then there's
okay.
private investors, or they're called VCs, to that they run the practices as well. So they'll take care of the business side, and you just see patients.
You show up and work. Okay.
Exactly.
Okay, okay, interesting. Okay. And then, so tell our listeners a little bit more about yourself. What drew you to medicine? Because just me chatting to you, my understanding is what really drew you to medicine was caring about patients. And that's the frustration with this current setup is you weren't drawn to medicine to see X amount of patients make X amount of money. You weren't drawn for the numbers. You were drawn to care.
Exactly. And that's what draws most of us to medicine.
Mm,
And, I love caring about people. I love the relationships I can form with people, and, which is obviously slightly different as a patient or a family member, but those relationships with people, that's what keeps me going every day.
mm.
That's what I wake up for every day. And that's what I love about medicine is just, I am able to be around people, get to know people, and help people. I love that part of medicine.
Yes, oh, for sure. And then what does burnout look to you? So burnout looks so different to different people. And you were talking about this moral injury. So the first time you experienced burnout, how did you realize that you have burnout?
I don't even know that I realized it. It was everyone else around me telling me that I was unhappy, and I'm like, no, I'm fine. I'm fine. It's the stoic doctor. I'm fine.
Oh,
Everything's fine. Everything's not fine.
mm.
It's the characters of Encanto, right? We're all those characters in Encanto.
And I think that's the tricky thing when I'm working with physicians who are going through burnout is it is, first of all, it is very slowly that it starts happening. It's very subtle. It's not as clearly, it's not one day that you, unless you're at the end, and you have proper burnout and you can't get out of bed, but that's properly when people recognize it. My goal is to teach people to recognize it sooner, to see that I'm not finding joy. I'm more cynical, less empathetic with my patients. And
Hmm.
just looking at stats that we have throughout Canada and in the US, the whole hospital system suffers, patient suffers. There's more med errors. Everyone suffers when doctors become burnout. You lose that empathy, you lose that energy to invest in your patients. And we have a hard job because our patients go through very difficult journeys, and we journey with them through those difficult journeys. So for you, you say that you didn't even recognize it in yourself.
I didn't the first time. Second time round, I'd been through it. I knew what to look for. But,
Okay.
a big part of it was, there's the work, and I could muster up the energy to do the work. But then I'd get home and I had no energy and I was short with my kids and, impatient and
Mm,
wasn't sleeping as well. And, finding I just, come home and I felt like I needed a glass of wine to
mm.
unwind, and
Wind
then a
down.
cup of coffee so that I have enough energy in the morning. And, like all that kind of self medicating of coffee to get going during the day, wine to just calm down. But why would I need that glass of wine to calm down? And it wasn't even, you know, to get tipsy or high. It was just like
Yes,
more the ritual of,
yes,
whereas,
yes,
now at the end of my day when I'm not burned out, I'm like, oh, I'm just gonna take a quick shower, and then I'm like showering off the day and get going. So
yes.
it's a different way of being. It's, there's that cynicism in medicine. There's not putting as much effort in, when I'm not
Because you
burned
don't
out.
have. That's
I
why
just
you
don't.
can't put that in a effort
Yeah,
in, because you don't have anything left to give.
exactly. I just, exactly. I would put, golly, 5, 10, 20 hours into figuring out some mystery diagnoses when I wasn't burned out. And then when I was burned out, I was like, "Oh, I don't know, refer."
Yes.
It's a very different way of practicing medicine. It's a very different way of being in my real life and just showing up. I just, I couldn't show up for myself or my family when I was burned out.
Because you just didn't have that. Sure.
Yeah.
And then, so to you, what is the biggest causes of, oh, so there's different ways, and Daniel H. Pink wrote this very good book, Drive, where he says, have you read that book?
No, but I love him as an author.
It's such a good book where he just talks about drive, what drives different people. But then specifically, if you look at, and everyone is different, but if you look at physicians as a general, as a whole, we are very much driven by autonomy and independence. And you found that that was one of the biggest thing that your work situation took away from you was your autonomy.
Absolutely. Absolutely. You take these smart, driven people who are, we're driven by helping people and driven by making things better. We don't need people to tell us XYZ. We are inherently, that's what drives us.
Yes,
And so you're absolutely taking that away from us, and you're taking away our inability to innovate and our inability to put thought into what's best. And that's just recipe for burnout right there.
and so what is the typical things that would happen? Because I honestly haven't encountered it in my work situation. I've never been managed by, because we have social medicine, I've never been managed. For us, it's really much about what's best for patients. So even though I've become burnout in my specific situation, it was just me doing too much, delivering babies, looking after geriatric patients, having a full practice, working at the clinic, working at the hospital. It was me that was just go, go, go. So, but in your situation, it's more systematic issues. But tell me a little bit more. How does it work? Who tells you what you should do?
Yeah, so in our system, you take people who are just like you. We're all very high achieving people who push ourselves too hard to begin with. And then what happens in the US is we have all these check boxes that need to be checked and all these metrics that need to be met. And then we're rated by patients and, sometimes other employers by, did you check their pain scale, and did you did you take care of their pain, even if they came in for a blood pressure check. Pain is like the new vital sign, which is
Oh,
completely irrelevant.
interesting.
And and you're told how many patients to see, and you don't get a choice if they double book you or triple book you. They tell you how long to spend with patients. They tell you, the medical insurance companies tell you what you can prescribe, and if you prescribe something that they don't approve of, you'll often spend half an hour on the phone, unpaid of course, with the insurance company to try to justify why your patient needs a certain medication. the
Sure.
way the way we need to bill insurance companies to get paid, the payment only comes months after you see the patient. You have to go chase after the insurance company. So often there's someone in each practice whose entire job is just getting the insurance companies to pay you.
Ah,
And even the way we write our notes has to be compliant with all the checkboxes and metrics and government regulations, and also has to be done in a way that we can get paid appropriately. So you have to hit certain number of bullet points in your in your HPI, and you have to hit a certain number of bullet points in a certain number of body systems in the physical exam, and then in the plan you have to do a certain number of things. So that alone is, you're not just thinking, let me just write down what's relevant. You're thinking, okay, this patient came in with a blood pressure check. I'm going to say that he didn't have red eyes, and I'm going to say that he had moist mucous membranes, or things that aren't really relevant to what you were there for. But if you want to get paid appropriately by insurance companies, you have to be very cognizant of things that are not relevant to what the person's coming in for.
Sure. This is devastating. So when a patient comes to you with a problem, you're not really able to be there present for the patient, is what you're saying, because you have set amount of time. In this set amount of time, you must check boxes, do a physical exam. This patient really just wanted to talk about, I'm anxious because I think I might have cancer. But you, on the other hand, to be able to bill for this visit, must check lots of boxes and do it in a certain amount of time.
Exactly. Well,
Oh,
so
that's a recipe for a disaster.
oh, it's awful. And
Sure.
I don't do that during the visit. I do it after the visit. So
But in
what
your mind, you must think, okay, I must check, does he have red eyes? What's his blood pressure? I must check, do this physical exam. So that's what you're running through in your mind.
Exactly. And then, I don't chart it during the visit because it's
No.
completely irrelevant. And then after the kids go to bed, that's when I do it.
Sure.
So it's all this extra time after you're done with work that you're actually finishing up your work, because it's not set up. You don't have time during the day to do anything other than see patients. And so all of the note writing and lab results and callbacks, that all happens after hours, unpaid.
Okay. So you're not really providing patient care. You're not making it better for the patients. You're not making it better for your staff. You're just checking boxes for a specific system. It's almost like AI. If I'm to write a computer program, that's what I would tell my computer to do all these things. But then generally for a human being, you can say, okay, you're a doctor, use your clinical acumen.
Exactly.
Oh my goodness. Okay, so that's very, very hard. And then that also explains, because quite often when you see clinics in the States where they would say to pay cash up front and to claim it from your medical insurance yourself, so that you can chase after your own medical insurance rather than having your doctor pay someone full time to chase after the insurance.
Exactly. And
Okay.
less doctors are taking insurance because they can't even keep their doors open. It doesn't pay very well, and you have to
Uh,
hire a huge amount of staff just to support the ability to take insurance.
uh,
So a lot of physicians' office just aren't. They're
you
either
you
dropping their lowest payer, which
mm,
is happening more and more and more, or they're just opening up and they just don't take insurance. It's such a headache.
yeah, yeah, and it kind of makes that inequality of healthcare, it makes it even worse. So people with cash will be able to access healthcare easier, and then your disadvantaged groups who might need it more will just have less access to healthcare.
Exactly. It's very unfortunate.
Oh, that's a big systemic problem. Oh my goodness. So when you work through this and you help physicians to navigate, so that's your business, is you help physicians who are stuck in the system to find a place where they can find joy in their work, where they can focus on patient care and what's best for the patient. But then now you have your own business. And then with an own business comes the same thing. It spills over into your own life where you can easily work 24/7 at your business. So how do you set boundaries in your own life?
I'm still learning. So it took me years to figure this out as a physician. I
Yeah,
had it down and, enter entrepreneurship, and I'm still figuring it out. So
yeah.
there are days when I really don't do it very well, and my husband comes in and he's like, hey, you're not working out anymore, and you're not, you worked
Mm.
really late last night and you're doing this. And I go, oh, I forgot, yes. And then sometimes I'm like, oh, I'm kind of mad at you for saying that, and then afterwards I'm like, oh, thank you, I really needed you to tell me that.
It's good if your husband is such an
Exactly.
advocate for you. Oh, that's amazing. That's good.
Exactly. So, it's a challenge. I have to consciously tell myself not to work. I even schedule my workout times 3 times a week, and sometimes like, no, I have too much. And so it's that driven part of what drives us all as physicians is I have more to do. I can do more. But
Mm.
in fact, I know, and I have to keep reminding myself that when I take time off, I'm actually more productive.
And you have to fill your own cup. because you can't pour from an empty cup. You can't be a good physician if you don't fill your cup. So what do you do to fill your own cup?
I exercise.
Good.
I exercise itself I don't love, but I take gymnastics classes and
Ah,
it's pretty fun.
for you. Oh, good
So,
for you.
yeah, I'm not a thrill seeker, but man, it's a good dopamine rush.
I can
Um,
imagine. I can.
so, yep, I do that and I can go into gymnastics feeling so down and then I come out on top of the world. So,
Uh,
that's,
okay.
my absolute favorite thing in the whole world to do. Spending time with my kids, especially, one at a time because then they don't fight.
And
Um,
that's smart for them to get that one-on-one time. Because I have 3 kids, and I remember my parents did it with us. I'm one of 4 kids. So they would make sure once a month they have with each one of us one-on-one, a lone date. We would go for breakfast or something. And so that's really my goal, to spend one-on-one time with my kids. But it's tricky, right? Especially if you have 3 and you're going to take one somewhere, then the others are, oh, we want to come. And
yeah.
then they end up playing with each other. Then we don't connect. So it's good that you're cognizant of that.
Yeah. Yeah, it's great. This weekend my husband's taking our 7-year-old camping and then my 10-year-old and I are gonna have a sleepover and we'll do girl sleepover things.
Ah, fun, fun. See, and that's such an incredible, and that's what you're saying. If you're burned out, then you don't have that energy. You're not in the space to go camping. You're not in the space. You really just want to chill out. And what I see with a lot of my clients is what they do is they'll binge watch Netflix. They'll just do something to not be present. And that's such a big dangerous sign, but it's also people don't recognize that.
Mhm.
Yes.
Yeah, I definitely notice, my whole day now in Happy Day Health in my new company, I'm sitting in front of the computer.
Mhm.
And so when I go have lunch or which I don't really take much of a lunch break, it's the doctor in me. But if I try to take a break, I have to consciously tell myself, don't go on Netflix, don't watch YouTube videos because I don't
Yes.
feel rejuvenated after I do
No,
that.
no, no, sure. So we spoke about that's one solution that you help. So there's different things that we can do for burnout, but you specifically help physicians to work in a situation that's not going to suck the joy out of them continuously. And the way you do that is to link them with private practices that tell me a little bit more. If someone contacts you, what happens? They contact you, and what's the next step?
There's a few different ways that I work. So one is I mostly work with physician-owned private practices
Okay.
to help them find a physician to join them. So I spend a lot of time getting to know those practices and make sure that I get the feeling that they're going to treat their physicians well.
Mm-hmm.
So I go out and I find them doctors. If a physician calls me up or sends me a message and says, "Hey, I'm looking for a new position," then there's a few different things I can do. Either I have a position for them that I can help match them up with if
Mm,
it's the right fit, but I'll spend a little time listening to what's important to them and what they want out of a practice. And then from there I can either match them up with one of my positions or I have a network of other positions that I can direct them towards. And that would be with a recruiter, but I would be vetting that position for them before they go ahead and speak with a recruiter. So
yes.
so I have positions and I have a very large network of other potential positions because some people want to work for big hospital systems. They want to climb that corporate ladder. That's not going to be the job that I have for them because that's not what I
Yes.
do, but I do
Yes.
have access to those positions that
You
other people
know
may not
where.
have.
Okay. Okay. Yes. Oh, that makes sense. And then, so what would be the biggest obstacle for someone to go from a hospital environment to private practice?
Knowledge. The biggest
Okay.
obstacle is knowledge. People don't know what's out there. So
Yeah.
I'll very often speak to physicians and more the younger physicians who don't know any different. They went through their training in a big hospital and then often they either stay in the big hospital or they just move to a different big hospital. So the biggest
Uh,
the biggest barrier is just people don't know that private practice what it can be. They don't know what's out there.
uh, yeah, see, that's big thing. And then, so what's the difference between you and a recruiter? Well, the fact that you're a physician, right? And you really understand.
Yeah, that's already a huge distinction.
Yeah.
For one thing, the fundamentals of helping doctors find jobs and helping the practices find physicians is similar. It's the same thing. But there's so
Uh,
much more that I do that is expanded out from there. So I'll help practices, I'll consult with the practices on what to do every step of the way on hiring a physician. If they don't know how they want to structure their partnership, I can help talk them through that, or
See,
how.
because that's a big thing.
Yeah, exactly.
Okay, so you kind of understand how the different options work because you've seen it all. So you can tell a physician, this is a good deal, this is a horrible deal.
Exactly.
Okay.
And I'm there for the doctors. I'm not, if I have a position that is not what someone's looking for, I don't want to place them there. I'm not there to just fill a spot.
Mm,
I do this because I want us to bring back medicine, and I want us to enjoy it again. And, there's so many more solutions than just leaving the profession altogether. And so I'm here to help people find that. And so I do spend a lot of time, actually, most of my time is spent speaking to doctors who are unhappy in their situation or want something different, and just helping them figure out what it is that they want. And then if something comes along, then wonderful, I can hook them up. But a lot of it is just figuring out, I want to do this, but I can't do that. Or I'll spend a lot of time speaking to doctors about what to avoid in their contracts, because
oh,
sometimes the
that's
contracts will
helpful.
trap physicians. I'm starting to do some public speaking to try to educate physicians on, don't sign a non-compete if it's going to prevent you from working in the city that you're living in.
Yes, because then you're that, oh, that's horrible, right? Because then
Hmm.
you're stuck. See, so we don't have that in Canada at all, this non-compete. So if you're not in a healthy workplace situation, it's so easy to just go to a different one.
Yeah,
I think that's the
it's
biggest thing, right? Is that non-compete. And then
it's
for how
huge.
long do they keep you to that?
It depends on the system. So it's usually 1 or 2 years.
Sure.
And that's in addition to, as doctors, we feel so much responsibility to our patients. We don't want to leave
That's
our
the big
patients
thing.
anyway. So add
No.
a non-compete onto that, and it's just, oh
Yes.
man.
But it's also a recipe for disaster if you then have a physician who is unhappy in that situation and he's just stuck by his contract, then he's not going to provide that patient care.
Exactly.
So
If the
you as the patient then are so much worse off. For you as a patient, it would have been better not to have access to that specific doctor.
Exactly. Yeah. The
Sure.
way to retain a physician is not to force them into staying, it's to keep them happy. An
Yes.
unhappy doctor isn't good for the doctor, the patients, the rest of the employees, the hospital system. It's bad for everyone, because
Yes.
it just takes one unhappy employee to just stink up the whole workplace.
Okay. So do you help people throughout Texas
I
or
help
throughout
people
Austin?
throughout the US.
Oh, throughout the US. Oh,
Yeah.
wonderful. And my understanding in the US is that you can only register in one specific state.
Yeah, so you have to have a license to practice in
That
each state
specific
that you
state.
see patients.
Okay.
So it's not that hard to get. Some of the states are harder, like Texas or California, can take 6 months to a year. But there's some states that are pretty easy. You can get a license pretty fast.
So you don't necessarily have to do your exams again. You just have to apply for that license.
Exactly.
Oh, yes, that's similar to Canada because I've worked in different provinces here. And so it does take time. It's the same as when I came from South Africa to Canada. They want everything again, everything, your criminal check, they go through your degree, your high school, they go through everything, but it's also due diligence from their side. So it makes sense that it takes 6 months to a year, but then you don't have to redo your exams. So you can move. Okay. Oh,
Yeah.
perfect. That's good. This was so insightful. Thank you so much, Lara. If one of our listeners want to contact you, they can have a look at your website. Can you give your contact details to them?
Absolutely. My website is www.happydayhealth.co. It's not a .com.
Okay,
And they can email me directly. It's my name, Lara Hochman, at happydayhealth.co. And I'm on LinkedIn as well.
perfect. And you're on TikTok and you're on Instagram
And
at,
maybe on
ha-
YouTube.
at Happy Day MD. Yes, that's awesome. And I will have your contact details in the description of the podcast below. Thank you so much, Laura. I really enjoyed spending time with you. And then for any of our listeners, that realize today that you might be suffering from burnout, because this isn't something that's unique to physicians. I've worked with so many clients, all walks of life, that do get burnout. And they didn't realize that, or if you now realize that this is why you're not finding joy in your life anymore, that it's really from burnout, please have a look at my website. There are so many resources. I have an online course that you can go through on www.wellnessmdhealth.com. And the course really explains step by step what burnout is, the whole physiology behind it, what happens in your body, and then things that you can easily implement to heal from burnout and to find joy again. Thank you, Lara. Take care.
Thank you for listening to this episode today by medical doctor Daniela Steyn. Follow us on social media and subscribe to our newsletter at www.wellnessmdhealth.com to stay up to date on educational resources that will take your quality of life to the next level. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your healthcare provider. Never disregard medical advice or delay in seeking it because of something you have heard on this podcast. Remember, you are created to thrive.